today. Thank you, everyone, for joining. Once again, my name is Travis McGregor. I'm here with Trained by Cell. I've been with the company 4 years. I've been really focused on, if you will, large enterprise and also government agencies, and so very well versed in the technologies. And so our title today, Hospital Nurses Gamify Learning Using Text Messaging, which is our specialty. So moving on, this is me. I just gave background, and I have Christopher Otto. Chris, say hi.
Hi, everybody. Thanks for joining us today.
And Chris, I think just to really kick things off, I think that if you can, oh, by the way, everyone, this is being recorded, so you'll have links afterward on the session, and it'll also be on our website. Chris, just give a little bit of background on the Christiana Care organization and what you do as a health organization, just before we kick things off onto other elements.
Absolutely. So I'm very proud to work for Christiana Care Health System. We are the largest healthcare provider in the first state of Delaware, located in the East Coast, Mid-Atlantic region. Our health system comprises 2 large main hospitals with a combined over 1,100 licensed beds, as well as a cancer center and research institute, home health and community agency, and extensive medical group of primary and specialty care offices. We are also Delaware's largest private employer with over 12,000 employees. And my role in this health system, I am by training and background a registered nurse, currently working in professional excellence, where we've been tasked with engaging registered nurses and advanced practice registered nurses across the health system. Out of those total employees, we're about 4,000, so about a third, in the advancement of, certainly healthcare, but also the nursing profession through different strategies and communication methods.
Great, that's a wonderful background, and we have a photo of one of your facilities, a beautiful looking facility. So you guys definitely do a good job, and I didn't know that you're the largest employer in the state. That's phenomenal.
Outside of the private, outside of the government there. Yep, and there's a map of where we're actually located. So primarily in the top portion of the state there, Newcastle County, is where those 2 large hospitals are centered.
Great. So moving on is that, engagement and training and gather feedback improvement. So this is basically, you said this before, what you do. If you want to elaborate, we can, or we can skip on to a new slide. But I think in your introduction, you did a good job of explaining what you do there. Is there anything else you want to add at this point, or should we just move on?
We can, the only thing I would add is that, when we talk about the engagement of our, nursing providers and healthcare team members, we really want them to be full partners in planning future communications, events, developing strategies, and in a complex health system, or really any industry, trying to capture and get all of those individual employees and their feedback. It's good to have innovative technologies to help complete that, and that's where we really saw Trained by Cell.
Great. Thank you so much for that. And so you mentioned your audience of 4,000 registered advanced nurses, and so I see this comment here of remote, and so I suppose this is maybe just not in Delaware. This might be at other locations, maybe outside of Delaware. Or can you explain that? Because one of the things that we face in working with a lot of organizations is there's remote and distributed type employees and workers and so on. Just kind of provide the landscape. If they're remote, is this more of caregiving? It's at residents, at patients' houses, or other facilities that might not be with you. Just maybe give a kind of a landscape of how these 4,000 nurses operate and the logistics that they face.
Yes, it's a combination of both clinical care and professional practice being remote. So in addition to, serving the state of Delaware, we have expanded and have satellite locations and facilities in our bordering states of Maryland, Pennsylvania, and New Jersey. So we have, nurses and other healthcare team members providing care in those remote locations. Up to, an hour and a half, 2-hour drive away from, our principal locations. And we want them to know that their input and feedback in, setting strategies, developing workflows is just as important as those on the main campuses for, designing their clinical care, and then also the engagement in professional practice.
Okay. I mean, it typically, we've always found with organizations, we have a lot of, in addition to Christiana Care and so on, a lot of hospitals, caregivers, and so on, and distributed workforces and so on. So from a training and credentialing and things of that nature, what is is it all online educational services, or is there satellite locations for in-classroom training? How do you actually deploy that when you don't have on-site, if you will, employees as nurses?
Yes, that is primarily virtual or online training for these remote caregivers. So we have different portals and technologies to deliver the education and communication about critical changes, learning opportunities, things like that. When necessary, we will bring, everybody on site, but the logistics of that is much more, challenging than to be able to do that on a weekly or monthly basis. So we do rely on the online communication.
Okay, great. Thank you for that background. So when you look at mobile, right, what problems or issues led Christiana Care to consider mobile? Because, I'll preface this in the sense that, when we started this, and we'll get to the background later on about our company, is that when using mobile, 8 years ago when we started this division, it was completely foreign to everyone. We've got a desktop or a laptop, and we've got email, and we have web type educational purposes. What was the consideration for mobile? And also, in addition to that, did you use any mobile prior to Train by Cell, either as a native app or any other type of channel for mobile, either in engagement, training, credentialing, etc.?
For training and credentialing, we had not began leveraging any mobile apps or technologies. We had, around the same time when partnering with Train by Cell, looked at an app for sharing clinical information and pathways, but not in the terms of training, education, credentialing, communication. We saw that need arise and really partnered on the mobile technology as a result of engagement and getting the feedback from a volume of nurses or healthcare team members. We saw our numbers dwindling, and we really want our workforce to be engaged and use their voice to let us know how we're doing, to give us opportunities for improvement that would better meet their needs and make it a better experience for them in the future. So in order to do that, we stepped outside and looked at different mobile platforms to identify what really worked best and completing that.
Right, great. Thank you for that background there. How did you hear about mobile? And this is a very expansive type question, and I think it's a marketing group, really trying to, assess, is this something that was an initiative? You said you looked at a lot of mobile apps for various different types of things. Obviously, you're regulated by HIPAA in a lot of regards, and so on and so forth. If this might be going back many, many years, but either what triggered a look at mobile, or what influencer in the marketplace, let's say, not us, maybe something else, got your attention about mobile and how it might be applicable on various applications, use cases in your organization?
Well, within nursing, I cannot take full credit for that. I have to give a shout out to my colleagues over in our Institute for Learning, Leadership, and Development. They were really pioneers in bringing this technology to Christiana Care and providing the support for different departments and service lines to begin using this and advance our communications. So can't speak too much about that because it was really brought to us by that great institute there.
Gotcha. Thanks for that overview on that. And so I look at this slide as I don't know. I think what first comes to my mind when looking at this is that, with a lot of the healthcare clients of mine around the world is that, they have certain pain points. And so with the SADs is, what situation did you think could apply? So we provide as an organization so many different features and applications and use cases. It might be just very straightforward on this slide, but if you want to elaborate on pain points that might have been resolved in using mobile.
Absolutely. It really started with those pain points of providing and receiving and analyzing feedback. Our caregivers were essentially tired of the way we had been doing it, relying heavily on email or other, internet-based platforms that, would only be able to be accessed from a desktop or a laptop, took additional time out of their normal workflows, but so they would end up just not giving their feedback, and we were left wondering if we had hit the mark or not, is how we really, first saw this technology as an opportunity to engage them in a different way.
Oh, and you're absolutely right, and we'll get into this a little bit later, but as a segue, this is not just from our organization. This is, in most the first world nations in the world, is that, the open read write on email, especially when a nurse or practitioner is not sitting at a desk with a laptop or desktop, 8-9 hours a day. They're on the go doing their job. And like you said, the workflows and so on are interrupted when, they're focused mainly on their core competency and their core workflow. And so, yes, I agree with you. Having mobile is a way that's part of our lives every single day. Smartphones are tied to our hips for the most part, 24 hours a day, 7 days a week, and on, turned on, always on data. And, so it's a very interesting, especially with people don't sit at a desk. So thank you for that comment on that. So, I'll just comment before I ask you a question here, Chris, is that, we've encountered over the years, an interesting pivot. So when we started this, everyone thought we were a little bit crazy, saying that, what are you talking about? We have email and we've got a web portal and they log in and e-learning and so on and so forth. And we've got, tons of information. And, back 8 years ago, no one saw, the pivot to text messaging. Now, text messaging will never, ever replace email, but it's become just a much more way people communicate today. And people always say it's just the younger generations, but the older generations as well. People aren't even taking phone calls. They're too busy. They're not listening to their voicemails. And a lot of times emails become long-winded. So the earlier days, from my experience being here at the company, is that senior management had difficult time. Questions about, one, employees using their personal phones. Well, we address that by an opt-in service. Two is that maybe, people that work a certain amount of hours or an hourly rate might work and look at this data offline after hours and want overtime. So we restricted, when they could access, information. And so concerns about reimbursement because of their personal data they're using on their phones, they can opt in, and so we've solved restricting times of access for overpay and so on. Those are the commonalities that I have experienced with clients that are in your vertical, Chris, and many other verticals. And I know that maybe you can't speak to this because your other colleagues are the ones who brought in mobile services, but does anything come to mind about, senior management, either currently or priors, either, no, we can't use mobile for certain reasons, or, what is it going to take to get buy-in, or what is the general consensus of buy-in as you're using it today? So it's kind of a multifaceted question, but this is always a concern at senior management on all kinds of employment-based issues.
Yeah, well, excuse me, it's certainly been an evolution in that acceptance of mobile technology. With the leadership of our Institute for Learning, Leadership, and Development, they certainly paved the way for that. But we also want to maintain an air of professionalism with our community and our patients and families. So we, have communicated to our caregivers that, really using this mobile technology in your workstations as opposed to, in patient-facing areas as the difference. But we're leveraging technology and mobile platforms to advance not only professionalism in healthcare, but also clinical knowledge and expertise and access to information in a clinical setting quite quickly. So some of that work was already in place by when we were adopting this technology as well.
Yeah, that's great. And I'll make one comment to that. With your organization and with a lot of organizations, is that it's a buzzword, but it's being used all the time now. Is that there's with e-learning, online, emails, everything else, sometimes the laser focused pertinent information that's relevant right there is hidden, and they're not going to get to it. And so I use a comment, which is not just my comment. I haven't coined this myself. This is an industry-wide, just-in-time content, meaning, finding the most relevant content that is just in time for the need of that professional, of what they need to learn, what they need to understand, if it's patient-facing and so on, and it just streamlines that laser focus. And so that's, what we have found mobile to really, really convey just-in-time, laser focus, short little exercises, so it's relevant to what they really need versus, scrolling through a library of massive information.
Correct. Yeah.
So, getting on to some of the, I know that other areas of Christiana Care use different application services, but some of the things that you have initially used, polls and mobile site for content storage, and just let me clarify, mobile site content. We have a mobile web app platform, and you can create, which we'll show you in a little bit, and you can load up all kinds of relevant content. So, a lot of organizations will say, well, I've got all this in the intranet. I've got this logging into our portal, and they can go search for everything. Well, once again, the workflows and so on mobile, you can load up any content you want, make it very, very user-friendly, good UI, UX, navigate to get that, and push it right to just in time to whatever group, if it's nurses or another group, or even segments of nurses that might be remote versus on-site. So just on your polls and the mobile site content storage for the future, any comments, because I know we said gamify, and I know that's a little bit pushing the envelope on this discussion today, but we've heard some things about polls being a very fun and interactive way to ask questions. So out of these services, or if you want to expand on other services you're using, maybe just write a comment on how this is being received in the operations with nurses, etc.
Yeah. So historically, we've had great success with leveraging the technology for completing polls, survey questions. We have done some minimal gamification in a retreat that we did for knowledge enhancement and retention, and really, did not require much, technical expertise or training to, really work the platform and build what you were looking for. It was well received because we, and I'll touch on, multi-generational workforces in not only in healthcare, but many industries. offering this technology as a supplement or an addendum or in addition to more traditional methods really increased the volume of meaningful feedback that we were able to analyze and make subsequent changes on. Has been a really great benefit for us within nursing as we continue to engage the workforce. And then speaking about the future, we're certainly in the midst of a really big recognition period, or receiving a national designation based off of the work that we're doing. So we are, looking at that mobile site development for that just-in-time quick access of information that our caregivers can access from, any point, that they're providing care. In preparation for that, it's going to be, a rather big, massive undertaking for us, and we, want to be able to get the information out to those that need it quickly. So that's where we'll be looking to leverage this technology. So we've had great success and look forward to, leveraging the platform in future ways as well.
This is off point a little bit because nurses are not salespeople, obviously, but, it'd be interesting. We have a new feature that we call leaderboard. So one of the things in gamification, it's not complete gamification, but it's putting your pinky toe in the water of starting to go that direction. Would you think that with the 4,000 nurses, if there was an incentive to say, hey, if we have analytics to show if content's being consumed, if you're reading something, watching a video, answering tests and assessments correctly, and so on about the credentialing or certification, would you think it would, and you could add points to all these, and then you've got an avatar, a picture of the person, and so it's a competition. It's just, the people or the nurses that, go through all of these educational process through mobile, and, the top 10, let's say, with the most points, maybe get a pay raise, or maybe get a free trip somewhere, or something. Do you think that might be of interest or would that be a nuisance, you think? Do you think that's incentive like that for your people?
That would be something certainly to explore for future application, because we've done some of that historically just in other, formats. So anything, to make it easier moving forward is certainly worth exploring.
Okay, cool. Because I know the salespeople, they eat it up. They're so competitive. they want to win that trip to Hawaii for sure, right?
First, yeah.
So, poll for training event and satisfaction. I didn't create this deck, and so it's a little bit vague. Any comment on this, or we can move forward? Anything that you want to comment is great. Otherwise, move forward.
Just reiterating something that I mentioned previously, but using this platform to capture satisfaction and feedback on different training events, so that the steering committee or the development committee can make rather immediate and quick changes to future training events based off of the feedback received.
Great. Thank you so much, Chris, for that. So we have this, our marketing group put this together. So, when it comes to, it's just background, there's two methodologies. Employees can opt in by texting in the keyword to, here's this text magnet to 56512 in the case of Christiana Care, or, there we go. So, how do you get the word out? Is this signs in various departments? Is this on your website or your internet portal? Do you send this as an image through email to let people know they can opt in for this mobile service? What is the getting nurses or other individuals to subscribe or opt into the mobile service? What has been your methodology to do that?
Yep, really a smattering of everything that you just mentioned, including, real time during the training events or engagement events, different retreats, adding the instructions directly into slides or content that we're giving. We've actually, said to the participants, get your phones out, text Magnet to this number, and take a few minutes to go ahead and let us know how we did. So direct feedback that way. And then we've also posted it on, internally on different websites with instructions on accessing the mobile platform.
Great, great, great. And by the way, for the attendees here is that in addition to opting in to have people text in to be added to a specific list, you can also import any groups of mobile numbers and then do a push. Gamification, and what does this mean? This is a very broad term, and for the attendees here is that by no means, are people playing these very sophisticated graphical games and so on. And what we mean by this is, getting feedback on polls, as Chris mentioned. It's also a gamification and leaderboards, so people competing to get to a point at most points for incentives and things. The title of this is, gamifying for nurses. Chris, have the nurses who have actually participated, are they finding this of use? Are they excited they are in here, or is this something they're saying, oh, I just have to deal with this? Because it is an opt-in service to your organization, I believe. But anything you can comment on this and how you we think it is in training, which obviously is not the funnest thing in the world. But what did you do? What's the feedback so far on making this fun for nurses? And what did they think?
Well, for us, that really goes back to that multi-generational workforce, because some people loved it and some people, wanted their more traditional methods of providing, that feedback or learning or training. And we were okay with that because we were providing options for the range of participants and engaging each of them in different ways that meant something to them. So for us, it was really about giving them the options and allowing them to respond to what worked best for them, and still getting that meaningful feedback for us so that we could better plan future events.
Beautiful, beautiful. And it's really down to choice, right? And I think that's kind of the flow or the nature of your comment, because you're absolutely right. Based on generation, based on what individuals are used to doing, and maybe they object or kind of abrasive against change. From my experience with my clients, and I've got a number of clients in either medical and healthcare, insurance, and so on, is just that. You need to give choice. Give them the flexibility. If they want it mobile, maybe the younger generation will do it. Maybe the older generations are not going to do that. So thank you for saying that. And it really needs to give a lot of different choice options. And so the reason I picked, showed this is, I could go through, which I can do today, a tutorial on how easy it is. But we have built, and what you're seeing here is that you can build these mobile web apps and push content to any group of users for any purpose. Since you're an administrator of the system, was it easy? These drag and drop, provide some textual information to read, look at some images, watch a video, listen to some podcasts, take a poll, take a quiz, fill out a survey or form. Did you have to involve IT? Did you have to involve engineering, or was this something intuitive enough that after you got familiar with it, was it straightforward, and was it time consuming to the point that it was frustrating or not frustrating?
No, so I can comment on a couple of things there. I really did find it intuitive. Went through, I think it was 1 or 2 training sessions with that Institute for Learning, Leadership, and Development that initially adopted it, and then kind of hit the ground running with developing content for different venues within nursing. I really enjoy the previews that you're able to get, shown on the right side of the screen there on the cell phone, so you can see a preview of how your content's going to look on a mobile device or on a traditional, web internet-based device. But then also the, timeliness of it and effort put into it. I recall specifically a retreat where, the leader or the chair of that group had sent me the information literally the day before and said, hey, Chris, can you turn this around? We want to get feedback on it, at the retreat tomorrow, and was able to, yeah, and not that that's never happened to anybody on the phone, that's real world, but was able to, quickly meet their needs and get that turned around and ready to go for the next day.
Great. So, getting this on the fly, I'll just kind of, very quickly here, because we're running into over 30 minutes, so I wanted to be very quick on this, is that we have extensive reports and analytics, and so you can have a dashboard view of what content's being consumed, what results, polls, quizzes, assessment surveys, and so on. We can get very granular and look at, individual type reports. We do have an open API if you need to tie to a different database to auto-populate. We also have everything exportable to Excel and CSV, which is, so we're flexible on all of that. Just a few things on reporting. So very extensive reporting, real time, always accessible, exportable, running dashboard reports. So you can see kind of a nice pie chart, line graph, bar graph of everything happening, but very extensive on that. So you had about 100, nurses opt in to do the test. So we don't need to go too much into this, but they find it helpful. And then one thing that you mentioned, which is very good, having the choice. It does not replace traditional modes of communication as both multi-general staff. You've covered most of this. Is there anything that you want to say further to these nurses who opted in and the effectiveness, either based on reporting to see what the engagement was and so on? And do you plan to roll it out to even more?
Yeah, nothing to comment on other than what we've already discussed, but yes, the plan is as we continue to expand and pursue different endeavors, this is technology is in the forefront of our planning. Great.
And the one thing that I'll just real quick on training and development, real quick here. I have many clients. One example is an automotive company that has 12,000 employees at dealerships, and they pay millions of dollars for third-party trainers to come in with curriculum every calendar quarter for in-classroom 2 full days. And this calendar quarter, they have new curriculum, and they do an assessment to see what they retained, what they've learned and remembered from the prior quarter's training. 80% was forgotten. It was a disaster. And it's, it came to me and said, what do we do? We're paying. I said, no, keep the classroom trainings, but use mobile and send out maybe 2 to 3 text messages a week with a 5 to 10 minute exercise, so it doesn't feel like work, and it's that constant reminder. After 6 months of doing this, the retention rate went up to 85%. So it was phenomenal based on our day and age of constant reminders, sustainment, learning retention, or what the industry calls micro-learning. Just a little segue into that. So we don't need to get into this, but we ran a report on some of the things that you're doing. Significant number of page views based on the content you're pushing, which is a healthy sign that people are engaging based on the nurses that had opted in. And then going forward, you mentioned that, and so I don't think we need to really cover that due to the time and so on, but you did say that is that you're looking to expand the services, make it available to more that do want to opt in and use it on a regular basis. Probably the remote is going to be maybe more of a focus, but once again, nurses are not sitting at a desk all day. They're helping patients, and that's what they need to do on their workflow. And conclusions, I think that, I said this before, is let people have a choice. What works for them works for them. And, we do this as a company all the time, and we're not, trying to pitch, if you will, or influence that this is the catch-all for everything. It's just there's a pivot in a lot of generations and people that want to do more on their mobile phones. And of course, people want to have old-fashioned email drips or logging into portals and so on. So we've covered that, and I'll skip over that due to time. Not going into too much about ourselves, but the company's been in business for 12 years, but in this area, servicing corporate enterprises and governments, 8 years. And we've had a very unique offering and approach that we really haven't seen as competition of how we do this. Many household names, about 1,500 clients around the world, engage with an employee for training, onboarding, HR applications, you name it, to really be effective. I mean, one example is Bloomberg Financial. They came to us pulling their hair out and said, we have employees all around the world and they're never hitting our deadlines for open enrollment. So they sent out MMS, which is a media message, and it had a Dilbert cartoon, and it made everyone laugh. And so they immediately responded to what they needed to finish on their benefits. And so just all these things you can do, make it funny, make it game-like, etc. So we have a lot of experience, and we keep building on the tools and applications to make it more applicable for all the verticals that we get into. Real quick on this, because of timing, is that we have 2 platforms. We have one of the most, we're not just a Twilio and so on that just, you link an API and you push a bunch for marketing reasons. If anyone wants a demo to go through the specifics, we have one of the most complex and detail-oriented feature set to manage so many different ways of sequencing, to SMS schedule, to chat features, to you name it, secondary keywords for automated responses. All that is available in our text messaging, both SMS and MMS. And then with the mobile web authoring or mobile web app platform, you can build content on the fly. As Chris said, he got all the content the day before, was able to create it and push it and so on and so forth. So one of the things that, I'm not going to go into benefits because of time, but if everyone that's attending today, if you want to just see a little bit of a demonstration on your phone, I urge you to text the word training, ING, on your screen to 56512. And I'll just give a few moments for any attendee that wants to do that. And then I've got Julio, my colleague here. They'll push a bunch of messages out for those that opt in, at least for this demo for today. And you can see some of the interactions of how this works. And so we'll just give a few minutes. We're looking at the system on the back end, so we'll be able to see who texts in if you want. So we'll give a few minutes there. We'll push some messages out, and then we'll wrap this up as we're getting to well over 30 minutes. So I'll just give a few minutes on people texting in, and if people do and want to do that. So we've got a couple of already texted in. There are 30 seconds to a minute, see who wants to participate, and we'll send out some example messages, and then we'll wrap up. And then I'll make sure that everyone has my contact details, and I'll discuss offline, Chris, if you want to be a reference. I don't want to have all these people contacting you, but if that's something that you would like to participate in, that'd be interesting too, just to maybe ask you questions, but I don't want to say that until that. So Julio, if you don't mind, why don't you send just rapid fire some messages that might be relevant to what we're doing today. All right, so what's happening here is that the people who had texted in, we see your number. Trust me, we are very respect people's privacies, so these numbers will be deleted afterwards. But he's just going to push a bunch of messages here over the next 30 seconds. So you can kind of see the messaging and some links and different information and kind of the flow and example of how you might use this at your organization. So, and again, I'll have my contact details sent to all of you, and also their sales reps that if you want to have scheduled demos to get more granular on all the features and so on, we're very happy to do that and see how our mobile services and platform can be effective and applicable in your operations, whatever that operation might be. So a bunch of messages have been sent to those who have texted in. And I want to thank everyone for attending today. And once again, you'll have my information, but it's here on the screen, Travis at engagebycell.com. And my office number there, 415-997-0212. Chris, you've been invaluable today. Thank you so much for joining and also utilizing our platform. And I hope it continues to be effective to you. Anything you want to say on parting?
No, just happy to be a part of the conversation today, and thank you to you and your team as well.
Okay, wonderful. Chris, you have a wonderful day. All who attended, have a great day. And once again, this session has been recorded. It's available to you by email. We'll get it to you, and it's on our website. Post this. Again, thanks, Chris, and thanks all that have attended today. And have a great rest of your week. I'm signing off now, and all goodbye.